Theories are developed based on observations that cannot be explained with the existing research. What this means for the occupational therapist is that theories are available to us to help describe to our clients what is going on and how we can implement an intervention that is proven to be effective, and that way we can predict their outcomes to best serve them. In the Kawa River model, the model's main focus is water, which is represented by life flow. This is the client's ability to perform their daily occupations and how their occupations are being performed. So if for some reason the water is hindered in some way, OT interventions may be able to positively impact this patient's occupational performance.
Kawazoko, the river walls, consist of the river's sides and floors as well, and it's meant to represent the environment of the client. The Kawa model sees this as one of the important determinants of a person's life flow, because the environmental and social contexts are primary in creating a person's sense of self. The river walls are made up of 2 layers, and they are representative of the immediate environment and the ambient environment. The immediate environment consists of physical context, social context, and spiritual context, and the ambient environment consists of factors such as the economy, socio-political beliefs, religion, laws, war, and so on. Iwa rocks is made up of rocks of different sizes and numbers to represent discrete circumstances that can impede one's life flow. The rocks are the factors that the client has that create difficulty in achieving success. The rocks can affect other areas such as the river walls or the driftwood and change the river's flow. The rocks represent any issue or problem that the client perceives as an impediment to successful therapeutic outcome. And Ryuboko, the driftwood, represents the personal factors of a client. According to the Kawa model, the personal factors are not always negative or positive and may not always affect the water or the meaningful occupation. The driftwood can represent values, character, personality, knowledge, and experience, special skills, and special relationships. The 3 main concepts the Kawa model uses to produce a meaningful occupation is Iwa, rocks, which represents the challenges the clients overcome, Ryuboko, the driftwood, which represents the personal factors of the client, and the Kawazoko, the river walls, which represents the environment. Using this model for effective treatment should provide context and information to promote participation in meaningful occupations.
The Kawa model was developed by Canadian occupational therapist of Japanese heritage, Dr. Michael Iwama. According to the 14th edition of Willard and Spackman's occupational therapy textbook, Dr. Iwama led a group of occupational therapists of the same East Asian culture through a qualitative research study to formulate the meaning of OT and occupations. The group was challenged with coming up with a model that would be holistic and culturally neutral. Thus, the nature metaphor was developed and Kawa was born. A summary of the Kawa model written by Louise Peng, published in 2009 to ottheory.com, suggests that the Kawa model's concepts originate in occupational therapy. This model really aims at understanding a person's needs and overall experiences in order to facilitate the best treatment plan. The Kawa model applies to individual client functioning by visualizing a person's life like a river. According to occupationaltherapy.com, the fluidity of a river represents a person's health and wellness. The walls, the driftwood, and the stones symbolize individual personal factors and environmental factors impacting occupational performance. Having an understanding of what's blocking someone from achieving occupational satisfaction will help the client and the OT collaborate to create a treatment plan that'll help regain and enhance life flow. Many disabilities can inhibit someone from achieving desired outcomes. These can be physical disabilities, cognitive disabilities and decline, mental health, or social health issues. The Kawa model is a great representation of how change occurs for individuals. The many curves and turns in a river suggest that change is non-linear. The Kawa model aims at understanding a person's contextual factors, their strengths, their weaknesses, any challenges they have, and even their supports in order to come up with a plan that'll help restore life flow. According to Gillen and Brown, occupational performance can be pivoted in a positive direction by environmental adaptations, great therapeutic relationships, skill development, goal setting, and social supports.
I want to share some studies using the Kawa model. First, Wang and Chen 2020 created a pilot study on clients with schizophrenia in Taiwan. They used rocks and driftwood to analyze what these patients needed, and they found out that Wang and Chen concluded that occupational therapists can better understand and support clients with schizophrenia using the Kawa model. So this model was very important in this research. The next research was done by Kumar and Glosh 2022, conducted a research focused on OT students' experiences using the Kawa model. They concluded that the Kawa model was very, very effective in creating interpersonal relationships between the students. And lastly, in conclusion, Jamie L. Ober shared the positive findings from a scoping review conducted by Jamie Ober on the Kawa model, a powerful framework in culturally relevant OT. Jamie L. Ober concluded that the Kawa model is very effective in adapting it to different cultures and different people. And these experiences can further unlock its potential in supporting clients in their journeys using the Kawa model. I just want to say thank you for listening to our video today on the Kawa model, and I hope that one day you can use this model with your OT practice. To learn more about a client's functioning within the Kawa occupational therapy model, you can utilize a variety of methods focused on understanding the client's life context, experiences, and challenges. Using the Willard-Spexman occupational therapy book, some questions you can ask are, can you describe the flow of your life? What makes it feel smooth? What causes obstacles like rocks? Some ways that you can observe your client's occupational performance using the Kawa model is their observation or role-playing during the activity that they have problems with to identify what they need. There are some assessment tools currently available to help occupational therapists evaluate different aspects of human functioning. For example, according to Willard and Spexman occupational therapy book, the Canadian occupational performance helps identify problems in occupational performance. We can also use the occupational self-assessment. This self-reflective assessment helps clients identify their own perception and occupational performance. Some methods or techniques for interventions are defined by this theory are client-centered goals. We can create client-centered goals using this theory. For example, they could tell us the problems, and that way we can make the goals. Also, adaptation. We can modify the physical and social environment to remove barriers such as rocks and enhance resources such as driftwood.